Welcome to Making Sense of Caregiving. During this seminar, all participants will be in a listen-only mode. There will be question and answer session at the end of the presentation using questions submitted through our Q&A feature. Please remember the information provided in this web seminar is not intended as a substitute for your physician's guidance and care. My name is Rebecca Pauley, Program Director of the Life Raft Group. And now I would like to introduce our presenter for the day. Al Berg is a volunteer with the AARP NJ Speakers Bureau, giving presentations on a variety of topics of interest to older Americans. During the day, Al heads up cybersecurity for a major entertainment company. When he is not fighting off hackers, he is an EMT with Weehawken Volunteer First Aid Squad and lives in Weehawken with his wife and his very spoiled cat. I also have a very spoiled cat. Welcome, Al. Thank you for coming. I'm going to stop my screen and I will pass it to you.
All right. Well, good afternoon. I'm going to share my screen. I'll make sure I share the sound as well, so you'll be able to hear. There's some videos that we're going to have. And I'm going to share so you don't have to look at my face. Okay, so welcome to our presentation today on making sense of caregiving costs. And this presentation is based on the AARP Financial Workbook for Family Caregivers, okay? And we'll have some information about how you can get a hold of that document online later in the presentation. Yeah, my name is, again, Al Berg. I'm a volunteer with AARP, and I'm also, an older American who's starting to think about caregiving and care receiving. And caring for a loved one isn't always easy. But in this session, we're going to introduce some of the essential information caregivers need to more easily manage some of the complex responsibilities of caregiving. It's our hope that it will be educational and informative, and that you'll leave here today with more confidence in making your own plans, as well as a better understanding of how to plan for your care or the care of someone that you're caring for. So, some disclaimers. There always has to be a disclaimer because I'm not a financial professional. Please keep in mind that this presentation is intended to provide general guidance. It's not specific legal or financial advice. Your individual circumstances may differ, and you need to take those into consideration before acting. While I'm not a financial expert and I can't provide specific advice or recommendations, I'm confident that the information that we're going to cover today will help you make more informed decisions about your financial future. But be sure to consult a professional for advice regarding your personal situation, especially when it comes to financial, topics. Now, although I will do my best to answer the questions that come up during Q&A, but I would also point out that there's an AARP tool called Your Questions Answered, where you can search for the answer to your specific caregiving questions. And if your question is not one of the frequently asked questions, the tool allows you to submit a question to our experts, and you'll get a personalized answer within a couple of days. And we're going to talk more about that at the end of the presentation as well. But I will do my best to answer questions that come up. So let's get started. So being a caregiver is a labor of love that comes with a lot of responsibilities. It's hard to put a price on caring, but it does come with some real out-of-pocket costs for you, and that's whether you're the caregiver or the recipient of the care. You may be picking up groceries, helping with housework, or making trips to the doctor or pharmacy, and all these little things add up. Having a clear picture of what's involved, whether it's your care recipient's health, housing, or finances, lets you plan ahead and make the juggling act a little bit easier. And that's why the AARP has developed the Financial Workbook for Family Caregivers. The workbook is designed to help you focus on the financial aspects of your caregiving journey. We hope that these tools will help you feel prepared to minimize the stress that making financial decisions can cause. And note, we're going to use the terms care recipient and loved one interchangeably throughout the presentation because, of course, both terms accurately describe the loved one you're providing care for. So in this session, we're going to cover a lot of ground. We're going to talk about the financial workbook. We'll also talk about how to incorporate practical financial tips into your caregiving, and we'll add some resources to assist with your caregiving. And of course, we'll tell you how to get the guide. And there's also, in case any of you are members of the military or veterans, there's actually a specific version aimed at those populations as well. Okay. So family caregivers are thought of as an invisible army, but without adequate support, they remain vulnerable to financial and job-related hardships, as well as emotional stress. So I'm going to ask a question here that's up on the screen. You know, in 2023, how much did family caregivers spend on caregiving expenses such as transportation and home modifications on average? So if you look at the choices here, to give it a thought for a moment. I'm not going to make you tell us your answer, but take a look and think about what that number might be. And the answer actually is B. $7,242 of their own money spent on caregiving costs. And on average, a family caregiver will spend 26% of their annual income on caregiving expenses. That's a large percentage of a family's income. There we go. Now, think about the hours that people spend, unpaid hours that are spent by caregivers. And these are numbers from 2021. So that the numbers probably have gone up since then, although that was during the pandemic. So there may, the numbers may not have gone up as much. But think about, all the hours that get spent by people who are really doing a labor of love here and taking care of people in their family. The answer to this question is C, 36 billion hours with a B. That's a lot of hours. Okay, and those are unpaid hours that people are doing because they're doing it for someone they care about. And according to the AARP's report on caregiving, there are 38 million caregivers in America who provide an average of 18 hours of care per week, which gets you to that 36 billion hours of care. Now, they have put the average value of those hours. It's hard to put a price on caregiving, but they're saying that an average value of $16.59 an hour in terms of like what you would have to pay in order to get someone to do that caregiving. So that as a country, we're spending a lot of time and a lot of money, caring for our loved ones. So if we add that $7,000 in costs to the value of 36 billion hours of care at an average of $16.59 an hour, that comes up to $600 billion a year in unpaid care that people, are providing to their loved ones. Again, that's a lot. So what was all that money spent on? Okay, so more than 3 out of 4 caregivers incurred some or all of these out-of-pocket costs. Now, why did family caregivers incur these expenses? Love, yes. I mean, you do this because you love and care about the people you're taking care of, but also because professional home care costs so much more. In 2023, Genworth, a company that sells long-term care insurance, estimated the average monthly costs for homemaker services. These are things like light housekeeping, meal preparation, and running errands, right? This is not somebody with medical training. This is just to help around the house, help with activities of daily living. And that cost comes to more than $5,700 a month. Now, if you need a home health aide who is someone with medical training who can assist with bathing or other more personal needs, the cost goes up about another $200 a month, adding up to more than $68,640 a year. And that's a lot. So strictly from a financial perspective, it's more cost effective to provide care for a loved one yourself rather than hiring a professional. So here's how, you'll see how that estimated $600 billion in unpaid care compares to other spending. That $600 billion is more than the total spending from all sources of paid long-term services and supports, which was $531 billion back in 2020. And again, these costs probably have gone up since then. That $600 billion is more than all of the out-of-pocket spending on U.S. healthcare in 2021, which was $433 billion. And that $600 billion was more than total U.S. spending from all sources, including out-of-pocket spending on home and community long-term support, which was $245 billion in 2020. So this is a big problem for for both individuals and for the economy, and this is why we're here today talking about it. Now, those costs have consequences. About half of caregivers have experienced at least one financial impact as a result of caregiving, 45% actually. And 34% of caregivers report having experienced at least two or more financial impacts. And those kinds of impacts might be something like dipping into their own retirement savings to help pay caregiving costs. Or they might spend less on their own health care in order to pay these costs. And more than a third cut back on personal spending or stop saving altogether to get the extra money that they need to pay for a loved one's care. I mean, these are all sacrifices that we make for people that we love. So again, nearly 3 in 10 have dipped into the personal savings. 3 in 5, that's almost 24 million people, have a paying job in addition to their caregiving responsibilities. So that's almost like having 2 jobs or 2.5 jobs, depending on what's going on at home. But more than half of family caregivers have to take time off from their main job, reduce hours at work, or even quit their jobs altogether to accommodate their responsibilities. This can mean diminished chances for promotions, less job security, fewer benefits, reduced money set aside for their own retirements, and lower Social Security benefits for themselves when the time comes. So I know that's all been, we've been sort of being depressing here, and now we get to the better part of the presentation, which is what can you do about this, right? What can you do to safeguard your future and your finances? And the answer is really very simple. It's plan. And that brings us to the bulk of today's discussion, that financial workbook for family caregivers. And the first page of the guide says it all. Dear family caregiver, this guide was designed to help you on your caregiving journey by AARP and Jessica Allen, a caregiver for her husband who was injured on active duty in the military, and an accredited financial advisor. We recognize the toll that caregiving can take, so we've developed this set of tools to help you prepare. Okay, so a few points to highlight here. First, the cost of caregiving is high. Most families can spend close to $8,000 per year caring for a loved one. So please take note of that piggy bank symbol throughout the guide. Those are there to specifically highlight tips that could assist you financially while caregiving. Second, every caregiving journey is unique. There is no one size fits all. Your journey is yours, and there are no right answers. There are answers for you. You may be able to finish going through the guide in a day, or it might take several days. Whatever works for you is what works best. This presentation is simply going to hit the highlights in hopes of helping you complete the guide at your own pace. So before we talk about the guide, I'd like to play a clip for you from a Facebook Live session that we recently did with the author of both the General Guide and the Guide for Military Caregivers. Jessica Allen will explain the importance of this guide, especially if caregiving is suddenly thrust upon you, as it was with her when her husband was injured on active duty in the military, and how it can help someone provide you with a break, also known as a respite for caregiving, from caregiving for a while. So we're gonna play the video.
If you had a guide like this, you could start working on these things. You don't have to complete it all in one session, but the way we set the guide up is where you could come in and say, okay, today I'm going to work on this section. And then tomorrow, while you have that time, you can. And then before you know it, it's done. But the most important part about this guide was if something happens and you have to step away, you go on vacation, you take some respite, maybe you're sick, you can give this guide to someone to step in for you. And it's going to tell them, hey, his powers of attorney are located here. Hey, his care team is here. This is the doctor so and so does this. Oh, I'm out of colostomy bags. This is who I contact for that. Like, that's the whole purpose of this guide, is so you can pass it off and breathe for just a minute. So
Yeah.
it may take you a while, but it's worth it in the end.
Okay. So today, we're going to provide financial tips within 4 categories: health, housing, money, and the future. But please remember that personal finance is called personal for a reason. There is no one-size-fits-all solution. The guide is designed to help you prepare your caregiver's financial life in more specific detail. And after you complete the guide, it can be a key resource to equip someone to step in to assist your care recipient in the event of your absence. Also, we strongly suggest that you seek assistance from professionals. For example, once you complete your power of attorney, your will, your burial plans, and you should seek the guidance of an attorney. Once you list your debts out, perhaps you should seek an accredited financial counselor to help you create a debt management plan. The guide is designed to help you through the process. It's not designed to replace trusted professional advice. It's there to give you hints as to who you need to talk to. So first, I'm going to walk through the health section of the guide, where we're going to begin documenting plans for the health care of your loved one. And we're going to cover a wide range of topics, including health, sickness, and even death. And these topics can be very difficult to discuss, but it's vital to make the right plans for yourself and those you provide care for. And before filling out each section, you'll want to take the time to gather the key information that will help you complete that section. For example, before completing the healthcare team section, you'll need to collect all the contact information for your care recipients, doctors, hospitals, and pharmacies. So starting with the healthcare plan, and this is a section that begins on page 5 of the guide. You'll want to answer some very important questions about the care your loved one receives. First, who does the care recipient receive care from? Do they use Medicare? Are they a veteran? If so, what about the VA? Do they have private insurance? There are so many possibilities for healthcare coverage. Make sure you take the time to understand not only who the insurer is, but learn about their caps, their co-pays, deductibles, and perhaps most importantly, what they cover and what they don't. On the next page of the guide, you'll list health issues, medications, and accommodations. This page can be extremely helpful at any and all doctor's appointments and hospital visits. And emergency contacts are a must for any caregiver. Who can step in for you with little notice? Hopefully, you'll have more than one person who can jump in and cover things if someone, if the primary caregiver is not available. What other details can you add to this page to help medical staff with the care recipient? Does the care recipient have allergies that the medical staff need to be aware of? Do they have difficulty hearing or seeing? Do they live with memory loss or dementia? If you filled in the accommodations area, then also add the details on any accommodations that they use to deal with these issues as well. As a caregiver, sometimes you're going to feel alone, okay? But you're not. Caregiving needs to be a team sport. And in the section regarding the healthcare team, you should document all the contact information such as names, addresses, phone numbers, email addresses, and websites of other people that you can call on or organizations you can call on. Your care recipient's care team should know that you and should consider you, the caregiver, as one of the most valuable team players. Caregivers can provide medical professionals with crucial information that can make a big difference in treatment. And caregivers can often provide details that the care recipient might have forgotten or didn't notice. You might also want to check if your state or the state where your loved one resides and gets medical care has passed a version of the CARE Act. The CARE Act makes sure that caregivers are recognized when their loved ones go into the hospital, notified when the patient will be released, and given the instructions that they need for continued care before their loved one returns home. You can even go to aarp.org/wallet cards, and that's all one word, wallet cards, to download your free CARE Act wallet card for yourself and one for your loved one. These cards contain information on the CARE Act in your state. Fold the cards, wrap them around each of your insurance cards, and place them in your wallet so you'll have them when you need them. So let's think about the other members of a healthcare team. Do you have healthcare aides that visit your home? Is there a secondary caregiver that steps in for you so that you can take a break, or simply run to the grocery store? Who can step in with short notice? Are you a member of a church or a community-based club? Could a member of one of those organizations assist you? Do you have someone to chat with from time to time about the stresses of being a caregiver or a recipient of care? You can list any and all of these people in this section of the guide. We'll provide you with information on some resources that can assist you later in the presentation, but I'd like to mention two things that can really help when you do need to take a break. Respite care is a short break from regular caregiving duties. As we've said, caring for a loved one is stressful and it can have real consequences on the physical and mental health of the caregiver. A 2015 National Caregiving Survey by the AARP found that 85% of caregivers said that they would find having some respite helpful. But sadly, access to respite is limited by location and income and the health condition of your loved ones. One of the links we'll give you later will contain information that might help you find respite care in your area. Another thing to think about is that there are adult daycare programs that can provide caregivers with a needed break while giving older adults a chance to socialize with their peers and sort of break the isolation and loneliness that many people experience. The programs that they provide and the costs associated with them can vary, but your local, area agency on aging can help you with information. And you can find your local agency through some of the links we're going to talk about later in the presentation. A power of attorney. Power of attorney is very important. It's a signed document in which a person appoints someone else to act on his or her behalf. Powers of attorney are sometimes limited to a particular purpose or period of time. Other times they're general, and state laws on powers of attorney vary. So you need to know what the law is wherever you and your care recipient reside. Also, keep in mind that the guide only provides a power of attorney worksheet. The pages in the guide are not a power of attorney. Once you've finished the worksheets, you should seek out a legal professional to help you complete the actual power of attorney. And that power of attorney document needs to be notarized in order for it to be binding. Note that many financial institutions and medical treatment facilities require their own powers of attorney. And you should know that generalized powers of attorney are not as widely accepted as they have been in the past. It is at the discretion of every financial or medical institution or even a business to determine what power of attorney they will accept when you're doing business with them. You can have different powers of attorney for different financial or healthcare issues. You can also name multiple people to act for you in powers of attorney. While many people have one to two others they grant power of attorney to, you can choose to grant a power of attorney to whomever you wish, as long as the POAs do not conflict with each other. If they do, the person or service requesting the power of attorney will use the most recent document. Oh, there's a lot here. Even though they are the same questions, take the time to answer them both for you and your care recipient separately. Don't make assumptions about who your care recipient may want to appoint as their power of attorney for each situation. Now, where you keep the power of attorney is also vital. We suggest that you keep the original somewhere that it can be protected from fire, theft, flood, or other damage. You should also give a copy of the POA to the person that you are designating and encourage them to put their copy in a safe place. Some people acquire safe deposit boxes from their bank just for their POAs and other valuable documents. That's up to you. If your only copy is in a safe deposit box, make sure that your designee knows that and can access the POA when needed. It's very frustrating if you have, you've done all this preparation, you have the power of attorney, but if you don't have the document, it's not going to be honored because the person that you need to give it to is, will not take your word for it. So wills and estate planning, it's a sensitive topic and it can be very emotional, but it's very important to make sure that you take your time to complete this section of the workbook as well. Because these pages become your voice after your passing. The people reading these pages will be grieving your loss, but the information you provide can help them with their grief. If you take the time to list out what you want to happen, it takes the guesswork out for them. It can greatly reduce their stress and their grief levels during a very difficult time. And just like the POA pages, these questions need to be applied to the caregiver and the care recipient separately. You might be thinking to yourself that, oh, you don't have an estate. However, everyone has an estate. You might just have a few bank accounts, a pet, some material goods. But guess what? Once you pass, someone has to settle all of those things for you and take care of that, in my case, that very spoiled cat. Take the time and help them know what you want them to do. It can be so stressful for them, to have to try and make these kinds of decisions on their own, not knowing what your wishes were. If you have minor children, you definitely want to complete the will and or estate process as soon as possible because obviously you want to make sure that they are taken care of. But remember, just like the power of attorney pages, the pages in the workbook are not binding. While some courts might take into consideration your wishes upon being presented with these pages, it's in the best interest of those you leave behind to have an official will or estate plan upon your passing. So this is an area where it's definitely important to consult with a legal professional. Again, we're going to dive into a very difficult yet necessary topic. It's so important to make sure your final wishes are known and documented. And this is going to likely be a very tumultuous time for your loved ones, and providing an internment plan will help ensure that your wishes are carried out and will spare them from making very difficult decisions. We've only included one page in the guide for your care recipient, but there's plenty of space to add in your wishes as well. To ensure that your end-of-life plans will be carried out, visit with a funeral home and let your attorney know. They can suggest additional resources to help you complete this process. And unfortunately, end-of-life costs are really important parts to consider when deciding about your interment plans. Do you have enough in savings to cover your burial costs? If not, do you have enough life insurance to cover the costs? You don't want to leave the expenses to your loved ones if you can avoid it. Plan ahead so that they can focus on grieving and settling your affairs. So we've put the most difficult topics behind us. So let's move on to topics that impact your day-to-day life. We're going to start with issues related to housing and life at home for the care recipient. We'll also discuss transportation, which is incredibly important to think about to enable your care recipient to live in their home and community for as long as they choose and for you to provide the best care for them possible. We'll also talk about diet and allergies, and then we'll rifle through the filing cabinet. So, this section of the guide is intended to help you and your loved one get their home in order. If you live separately from your care recipient, you might want to take the time and fill out the pages for yourself as well. So you need to make sure to list due dates, amounts due, where the payment goes, and other vital information for important payments like, mortgage or rent, homeowners or rental insurance, property taxes, utilities, all of these things. It's very easy to forget these things and end up with a problem. Now, most utilities offer budget billing and should be used when possible. Companies use different terms for budget billing. They sometimes call it bill averaging or a range of other terms. And budget billing is where the company takes 12 months of your utility usage and creates an average bill for you. So rather than having an inflated heating bill in the winter and an inflated cooling bill in the summer, you would simply make the same payment every month. Once a year, the utility company will recalculate your bill and adjust it accordingly. Now, unfortunately, this service is not offered by every company, so you'll have to contact your utility to see if they offer it, but most of them do. Also, don't be afraid to ask for discounts with all the companies involved in your home. For example, there might be a military discount or other discount because of organizations like AARP that you belong to. And check to see if your state has a tax-free or reduced property tax exclusion for your care recipient. A reduction in property tax can save you or your care recipient thousands of dollars. And remember to ask for discounts on your homeowners or rental insurance policies as well. I have to say, I've gotten a lot of discounts simply by mentioning that, I'm an AARP member, I'm a member of AAA. I was really surprised. I did some work on my house. It turned out they had a discount because I was an EMT, so if you were in the military or something, it doesn't hurt to ask, and it can save you some money. So if you don't ask, you don't get. Access to transportation can be a really important factor in the care recipient being able to remain in their home. Can your care recipient still own, operate, and/or drive a vehicle? If so, there are pages in the guide to list all the information needed to own and operate a vehicle in your area. If you're the only driver, you can use these pages to fill out the information for yourself. Make sure you check with your local county clerk's office to see if your care recipient is eligible for any discounts or tax exclusions. For example, Purple Heart recipients in the state of Tennessee can receive their license plates for free. These free plates can save hundreds of dollars per year. Many other states offer similar types of benefits. Some states require automobile owners to pay taxes on their vehicles. Make sure that you know if that's the case in your state or in the state where your care recipient resides. And again, ask for discounts on vehicle insurance and public transportation. These saved dollars can add up quickly. I mean, my wife, was so happy. She just recently turned 65, and the first thing she did, she went and got her discount Omni card in New York City. And she was very, she like, that was, sort of for her a nice one of the nice things about turning 65. There's lots of stuff available out there. Again, you have to ask for it. Special diets and allergies. These are very important. You want to avoid causing any problems for the healthcare recipient, for yourself or for the care recipient, in terms of a special diet. Do either of you have any food allergies? Those are important to list. This could also help serve as a shopping list, especially if you have dietary items you need to buy every week. Does your loved one or yourself need an EpiPen? You want to list the expiration date for the EpiPen. Jot this in the other column in the special equipment category. This is really, these allergies is really, really important. As I do I'm an EMT in my town, and when we come to help people, one of the first questions we ask them is, do you have allergies? Because we don't want to make things worse. Some people are allergic to latex. Some people are allergic to certain drugs. And if you do have an EpiPen, when you need that EpiPen, you want it to be working. You don't want it to be expired. These are really important things to keep track of. So please do that. You need to keep your important documents secure. You might want to consider getting a small home safe. And for most people, it's, you're not looking to be Fort Knox here. Most of the biggest protection the safe gives you is really against fire more than anything else in most cases. But the contents of every safe will look different. We all have different vital documents. There's a list in the guide to help you get started. You can always add different types of documents to your own list, and some of the documents that they list in the guide might not be relevant to you. If you don't have a safe and need to purchase one, make sure it's available to withstand fire. And also make sure that the safe locks, and put the key in a secure location, and remember where you put it. You might even consider getting a safe with 2 keys and keep each set in a separate household for safekeeping. Make sure you use that lock. Locking your safe provides one more level of protection from identity theft. And as mentioned earlier, you might also want to consider getting a safe deposit box at your local bank, though it's getting harder and harder to do that. Banks keep closing branches and don't have them anymore. But like, for example, in my home, I have a small, fire safe that locks and keep things like insurance policies and social security cards and, documents that would be very hard to replace. Gives me a little bit of peace of mind. Like the safe contents list, there's also a file contents list to help you get started on organizing your files. I always heard that, like, now in this computer age, we wouldn't have paper anymore, but that doesn't seem to have happened. We still have plenty of paper in our lives. So consider placing your files, the ones maybe that don't need to be in the safe, but, maybe have a locked filing cabinet to, again, reduce the chances of identity theft occurring in your home and to protect them from accidental damage. And always, again, remember where you put that key or keys if you get one that has an extra set. One of the most important responsibilities as a caregiver is planning and managing money, both your own and your care recipients. Home is where most of us spend the majority of our time, and it's important to make your home a low-stress environment. And that, though difficult, discussing money doesn't have to be stressful. By taking the time to make your dollars work for you and your care recipient, you can create some peace of mind that will help make your time at home more enjoyable. So in this section, we're going to discuss budgets, investments, and debts. The first budget page is for the caregiver. And if you're married to your care recipient, you'll probably want to combine your budgets. It's vital that you give every dollar in your home a name, purpose. Tracking your dollars actually enables you to control your money. The page in the guide is probably not big enough to list every single dollar, but it can, you can group your expenses into the categories provided. Or, if you're a computery kind of person, you can open up a spreadsheet on the computer and do it there. Anything that doesn't fit into the lines in the guide exactly can simply be added to the discretionary category. However, if you want to be more precise, take the time to list your expenses out individually on a separate piece of paper. Now, there's not one way of budgeting that works for everyone. You might like using a pen and paper, Someone else might like the app they have on their phone. Some other folks like to have a spreadsheet on their computer. There are, budgeting websites that are available. The point of all of this, no matter how you do it, is you want to try and achieve a zero-based budget. That means that you have $0 left after you give every dollar a name. So for example, we have a college savings line on the form. If you don't need to save for college, scratch that out and just make it your savings line. The budget is really all about you, and you want to make sure you get to zero so that you know where all of your money is going, if and you can account for that. There's a free online tool on the AARP website to help you set up your budget. It's called the AARP Home Budget Calculator. If you do a search for that on the AARP.org website, you can find that. We added a caregiving budget because we realized that there are specific expenses related to caregiving. Caregivers spend thousands of dollars per year caring for others. Take the time to list out the caregiving expenses separately from the budget that you've put together for your personal finances. We also have a sheet in the guide to prepare a budget for the care recipient. Now remember, unless the care recipient is your spouse and you've done a combined budget, this budget is different than the one you filled out for yourself. Apply the same thoughts from your budget to your care recipient's budget. And if at all possible, the care recipient needs to be involved in that budgeting process. I mean, it's their money after all. Investments can be tricky. You need to not only have the money to invest, but then you have to also decide your risk tolerance towards investing so you can determine where you should place your money. And this is where a financial professional comes in. Spend time researching investment companies and decide which one is best for you. Make sure you ask about their fees and commissions. Find out if they will be acting as a fiduciary, someone who manages money or other assets for another person. It should go without saying, but you'll want to be sure that you're making more money than you pay out in fees and other costs. It's always very important to know, especially when a financial professional is recommending an investment to you. Are they getting a commission? Are they, what are the fees? Because are they recommending it to you because it's good for them or because it's good for you? I spent 20 years in the financial industry, and there's a lot of abuse out there, and a lot of people who don't have your best interest at heart. You want to find someone who is acting as a fiduciary. That means that they have to put your need first. Now, AARP has a tool called the Interview and Advisor tool, which is a free resource to help you understand a financial advisor's credentials, how they're compensated, and tips on how to get the conversation started around your needs. And that tool is available for a smartphone, a tablet, or a computer. And again, you can find that at aarp.org by doing a search. It's really valuable because there's lots of questions that you need to ask, and a lot of it is stuff you might not think of. Let's talk a little bit about debt. Now, being in debt is not necessarily a bad thing. Most Americans make payments for a house, a car, student loans, credit cards. The problem isn't the debt itself, it's the interest rates. The original debt you started out with can easily double or triple if you're not careful. And the debt system in America favors creditors, not the consumers. Being debt-free can offer you some additional financial freedom and peace. There are numerous ways to eliminate your debt. Most financial experts recommend organizing your debts from the smallest to the greatest balance. You can pay the minimum payments on the bigger debts and then take your available dollars to eliminate your smallest debts. And as you knock out the smaller debts, you'll feel empowered to attack the next smallest. To build a financial management plan, you can utilize two tools from AARP. They have a debt consolidation and credit card payoff calculators. These are two separate things, one for debt consolidation, one for credit card payoff. And they're found on the AARP Money webpage. and they'll help you gain a greater understanding of what actions you need to take to pay off credit cards and effectively consolidate your debt. And to access these resources, there are two sites for you to visit. They're at www.aarp.org/money/personal-finance/debt. This is like they're giving me very long things to say here. There's a handout that you should be receiving in the email that will have links to these. You're better off clicking on the links than trying to write down what me reciting URLs. So please make sure you take a look at the handout that you should get in the email, or just search on the website. They're called Debt Consolidation Calculator and Credit Card Payoff Calculator. Now, sometimes we need professional assistance with organizing our debts. Your bank might have someone who can assist you, or you can search for an accredited financial counselor known as an AFC in your area. Many AFCs can meet with you online or over the phone. Don't be afraid to ask for help, but make sure you're talking to someone who is an AFC. There are a lot of people out there who are, will present themselves as, people who can help you get out of debt, and they're not really, they're not taking your best interest at heart. So look for an accredited financial counselor. So let's move on. So let's turn to something that's important to you, the loved one you care for, and everyone in your family, the future. Think about what your future looks like and what are your goals. Think about, do you need additional education to achieve your goals? Do you have a retirement plan? Do you need to save more for retirement? And how might those caregiving responsibilities affect those plans? It's important for you to thoughtfully consider all of these questions and to speak with the care recipient and the caregiver about what they want for their future as well. You can use information from the financial section of the guide to evaluate your options. And there's a page included for the caregiver as well as the care recipient. You both have to be thinking about this because your plans could be similar or they could be vastly different. So here's where we get to where you get the workbook. We're gonna now talk about some resources and key terms. And we've listed some amazing nonprofit organizations and governmental agencies that can assist you and your care recipient, as well as some terms that you may encounter while acting as a caregiver. And it's important to understand these as a care recipient as well. So let's move on to that. My clicker works. There we go. So if there's there are different versions of the workbook that I've been talking about during this entire presentation. The financial workbook for family caregivers. There's a general version. There's a special version for military and veterans that that takes into account some of the resources and benefits they have available and some of their special considerations. And there are also versions of the workbook in Spanish and Chinese. If you need the Chinese or Spanish workbook, I hope you are understanding what I've been saying so far. But if you know someone who needs it, it's there. But you might want to take a minute to jot down. These are also there are links to these also on the resources document that you will receive. They are PDF files that you can actually fill in right on the screen if you like. So everything is neat and tidy. Now, earlier I discussed a place where you can get all your caregiving questions answered. And this is that tool called Your Questions Answered, where you can either search for answers to people's questions, questions that people have already asked, or you can ask a question of your own. And if it's a new question that isn't already in the question list, you'll receive a personal answer via email within a couple of days. So to search for answers, you again go to the AARP website and select caregiving. Go to the Your Questions Answered page and select caregiving, And then you can either scroll through the frequently asked caregiving questions to find one that matches yours, or you can enter your own question into the dialog box. Now, you do need to have a current AARP.org login to utilize this tool, and you'll need to be logged into the website to submit your question. Joining AARP is very inexpensive. It has lots of benefits. It's a good investment. AARP and other organizations have, especially those supporting veterans and military families, have many resources to help you. And there is a list of a number of them right now on the screen, but also in the back of the workbook. There's also a caregiving resource center and a family caregiver support line in both English and Spanish to help you with tips, tools, and resources on your caregiving journey. And the caregiving guide is available online. It's a fantastic resource you can use as you approach becoming a caregiver. And if you're a care recipient, it can help you understand some of the challenges that the caregivers face. Again, it comes in different versions because everybody has a different journey. If you're interested, the AARP actually has a family caregivers discussion group on Facebook to help you get support during your family caregiver journey. You don't need to be an AARP member to join the group. It's free. And sometimes just being able to talk to someone else who might be facing the same problems that you are, is A, it just might make you feel better, and B, they might have a solution, to suggest and to help you. For additional resources, AARP has a page, aarp.org/caregiver resources. Again, all one word. Now, finally, there's one more sensitive subject that I do need to bring up. We all know that caregiving can be very, very stressful, especially when it is over a long period of time. So in the back of the handbook, we have listed the National Suicide Prevention Lifeline listed there. The Lifeline has staff on call 24 hours a day, 7 days a week, every day of the year, to talk to and to support you if things are getting too difficult and you feel overwhelmed, or your caregiver feels overwhelmed. And anyone who is having suicidal thoughts or thinking of hurting themselves or the person you're caring for can reach out by calling 1-800-273-8255. And this number is in the caregivers, in the handbook, and it's something that it's available. People should make themselves avail themselves of it if they need it. If you don't have, just call 911, and local emergency medical services will come as well. But so I hate to end on a down note like that, but I hope that you enjoyed the presentation and got some resources that you can use. Thank you for being here today. We've reviewed financial tips for caregivers within 4 categories: health, housing, money, and the future. We've also shared some additional resources to support you in your caregiving journey. And we hope that you stay connected with AARP. AARP is not just about caregiving. We have a lot of other learning opportunities that you might be interested in. We have online learning. There are events, webinars, and more about things like Medicare and Social Security and caregiving, fraud prevention, which is one of my favorites because that's what I do for a living. Work and jobs, and more. So if you go to learn.aarp.org, you'll find a catalog of all of these different things. Many of these events are online, like this one. You don't even have to leave your home. Please take advantage of them. And also don't forget that AARP is also local and offers meaningful connections and enriching experiences close to home. And if you go and visit AARP/local, you can find what kinds of activities and resources are available close to where you live. So again, thank you for joining us. I see that the handout is in the chat, so if you need, the handout, like you can actually download it right out of the chat. And again, thank you for being here today. I really hope that this was useful.
Thank you, Al. We have about 4 minutes left in the webinar. If anyone has any questions, you could put it in the Q&A feature. And while we wait, I do have a question. You mentioned a packet or something like that where the caregivers can enter all of the information into it to give to someone else.
Yes.
Can you repeat what that's called? Because I think it
I'm
would be
actually
really helpful.
let me paste that into the chat. Hang on a second.
I think it was for military members, but I think it can be applied to.
Yeah, there's a version for military and there's a version, hang on, let me just get that for you right now. And I'll paste it into the chat.
Yeah, as he's finding it, I just think it'll be really helpful for caregivers to have something like that for the patient with all of their information in it in one place. If God forbid something happens to them and someone else takes over for caregiving, and just to keep things organized. I think that's really one of the key things in caregiving is keeping things organized.
So here, the first link I'm putting in is just the general caregiving guide. Let's see. You can download it right from there, and they're all different versions. There's the military one. There's ones for, in English and Spanish and Chinese. It talks about the various things, and then the financial and legal. Here it is, the financial workbook for family caregivers. This is that document that we were referring to in the presentation, the financial workbook for family caregivers that has all of that healthcare plan. That's the link there. And I'm just going to put one last link, which is just the general caregiving website for AARP, which just has a ton of other stuff that you might want to to look at, and some more up-to-date information. So please, let's see. Let me make sure. Oh, you know what? This went to just host and pass. Let me make sure these go to everyone. Hang on a sec. 1 second. I will repost it. So the first link I'm going to post is the general caregiving page, which has links to everything. The second link is the workbook that we talked about in the presentation. And the third is the family, there's a general caregiving guide that AARP has.
I will put these links with the YouTube video when it's reposted so we can access them again. If anyone, we have one minute left. I don't think anyone has any questions, but if you do following this webinar, please email liferaft@liferaftgroup.org and we can get your question answered. Thank you so much, Al. Have a wonderful day, everyone.
Thank you, and take care. I hope this was helpful.
It definitely was. Thank you.
All right.
Have a great day.
Bye-bye now. Take care.